All right. I think we're live, Marina.
Yay! Nice to join
Um,
you on this Friday.
I do not know if we're live on LinkedIn, though. It doesn't appear that we are. Again, this technology is making me crazy. Okay. Well, we're just going to go with it. All right. So thanks for joining me today, Marina. Very excited to talk to you about the project that we've worked on in the last year. I'd love for you to start by telling us who you are and telling us a little bit about Welldoc.
Sure. Hi, everyone. I'm Marina Dorotheo. I'm Chief Marketing and Strategy Officer for Welldoc, which is an AI-powered multi-condition digital health company or a health tech company. We are really the health tech behind some of the biggest brands and really innovative care programs that are happening across life sciences, health plans, employers, and health systems. And really our start was in diabetes, but now we represent a multitude of different conditions and really are focused on providing AI-powered coaching and insights to help people on their health journeys.
Excellent. And healthcare tech and branding for healthcare tech is one of my favorite kind of brand lanes to work in. I find that healthcare people, especially in technology, are very dedicated and very committed to what you guys are doing. You have a lot of vision, and it's always a lot of fun to work with that kind of company. So one thing I wanted to ask is, when we met mid last year, which was, I think it was maybe summer, I think, when we were really started talking about this project. What was Welldoc needing for, and, what were you looking to accomplish when we first started talking?
Yeah. So I think as you have worked with a lot of health tech companies, we tend to be, that startup culture is part of our DNA and we have a lot of passion around what we're doing, but we have to do a lot with a little internally.
Yeah.
And as such, we had this legacy platform website that really limited us from being able to kind of move our story forward in the way that we wanted to and our brand forward. So we had limitations. We were doing all of this really, really exciting stuff, and we were moving in really, really exciting directions. However, our brand and our website didn't always reflect that forward momentum, particularly which I know we're going to talk about during our session today, just all of the things that are going on in our space that are really just paramount to what's driving health tech forward.
Well, when you started looking for a partner to help you guys with that kind of stuff, what were you looking for? And yeah, sorry.
Yeah. So, and, I come from a pharma background, so I'm very used to having that lovely threshold of agency support. But what I've always loved is having agencies that help you figure out your vision, figure out how you want to translate that. Because sometimes when you're in it, you can't always
Mhm.
see all of the lenses across a multitude of different angles. And so I think we were looking for a full end-to-end partner that just would help us with the technology of a Webflow platform, but also use this as a real opportunity to shift how we were talking about ourselves. So we
Mhm.
saw this as a very strategic project that was way beyond just a website project. This was about positioning and resetting a brand in line with the momentum that we had been building and using that to really now have lanes into a multitude of different pieces of what we're doing as a brand.
Do you find that was it easy to find a place like us that does full stack, or was that a little bit more rare, or are a lot of us out there?
Yeah, no, that I have to say, you guys were really, really rare in that, a lot of the vendors that we were looking at, and they weren't looking at it from an agency. They truly were looking at it from a tech platform and, oh, we'll
Sure.
build whatever you want, rather than really looking at it as a strategic asset
Mhm.
that you needed to do. And so I think a lot of the vendors that we kind of came across, they sort of were tilting more to the tech and not as much on the creative and the branding.
So let's talk about, like, the relationship, but just for
Yeah.
a second, I'm sure we'll dip
Yeah.
into it several times, because that's honestly, one of the best parts of this project for me was the collaboration between our team and yours.
Yeah.
But what is it, yeah, I'm sure you've hired multiple agencies in your life. When you're bringing in an outside agency on something that's like, that's really central, right? We're talking strategic. We're talking like you all were changing the way that you behaved in the marketplace, the way that you saw yourselves, and then building on a legacy as well, obviously. What does it take for that relationship to really work? Like, what did you need from us too?
Yeah, no, and I'm curious. I'm going to ask you the same
Oh, yeah,
question
I love it.
because I think part of a relationship is both, right? But I
Mhm.
would say, going back to that startup-y DNA, we move fast, right? And we
Mhm.
make decisions fast, and we also change fast, right? One of the reasons we were moving to Webflow was to allow us to have this really great tech and new standard and foundation so that we could continue to iterate and continue to move. And so we needed a partner that would move as fast as we did. And I think you all saw that as we were going. In a lot of cases, we were changing the way we talked about ourselves. I think you and I collaborated quite a bit on
Yeah.
the content because you would drive ideas towards me, and that would just, flourish a new idea or a new thought that I'd then kind of take and then redo, And so
Yeah.
I think that iterative process and that working together, that takes a lot of trust that we had to build really, really fast together, I think, right? We dumped a lot of stuff on you just so that you would learn how we talked about ourselves. I think you saw the passion, not only that my team brought, but just Welldoc in general of solving big healthcare challenges that sort of came through in your interactions with the leadership team. So I
Mhm.
think it was a lot of, just picking up information fast, being able to connect things really, really quickly. We needed someone that did that as fast as we do. So that was really the thread, I think, that really made us good partners.
Yeah, and I think if I look back on it, um, there was a lot of stuff that you guys brought to the table too. That was pretty pivotal. I think. Well, I think your question was going to be like,
Yeah,
what
what
are the
did
things that
I'm
we, yeah,
curious.
yeah, what did we bring?
Yeah, I was just interested in, as we were getting to know each other, we
Mhm.
did throw a lot of information, but you guys are really good at organizing programs in a way to get the information, distill it. And I'm just curious, what was helpful from the Welldoc angle to help sort of, because we moved fast to start this project, right? And we had some pretty aggressive timelines to start
Yeah.
with. How did you all navigate that and just being able to navigate all of that information coming at you from different
Well,
angles?
yeah, and it was a we like to say when we start a project just to back the dump truck up, and you guys backed the dump truck up. Like almost literally. I think it was 300 different pieces of different resources and 5 gigs in our box drive, which
Oh,
is
wow.
it was a lot. It was a whole lot. But it was amazing because we poured over all of it, and it helped us really get a nuanced picture of who you have been and all the things that you were saying about yourself and the way that you were thinking about your product and the way that and it helped us get into your world, honestly. So that was really useful, and it was like I never turn away like a client provided resource. I'm just like, anything, something could be useful in there. So we were really happy to get all of that great background information. I know we did a really good discovery session, or maybe several with you guys, I think, because we talked with, actually we did, we talked with the AI team separately. We talked with you guys in various different combinations. We got great access, I would say, which is always really helpful. You guys gave us access to the people that were the primary source, the people building the products, the people, doing the marketing day to day, the people talking to the customers. And you were willing to be engaged in those sessions and also do a little homework afterward. I
Yeah.
think we'd asked you to go back and think about the personality and think about the, how we were going to present that. And then just something else that you guys brought was like this continual willingness to like dig in. You co-created with us. I would say like just entire way.
Yeah.
Your design team and our design team were working in tandem. We were going back and forth on palettes and editing copy. I think I talked to you in an airport once about copy. Like, I mean, it was all hands on deck and all in. And what was great though is that sometimes that level of sometimes that it's not collaboration. Sometimes it just feels like control. And it never felt like that with the Welldoc team. It always felt like we were moving together, locked hands toward a goal. And it was never contentious. You pushed us. Oh yeah, we can talk about that. But it was
pushed us too.
Yeah.
Yeah, and I think the other thing is at the same time we were bringing in a new PR firm as well.
Mhm.
And so we didn't want to divide that work, right? It all lines up together. And so we tried to combine both shops so that you both were hearing the same information and leveraging it in different ways. So that made sure that we were creating cohesion across our major strategic programs that we had going last year as well. So the narrative that we developed from a PR standpoint directly reflects all of the work that we've done. So it all ties together really, really nicely. So I thought that was a nice way that we brought you both together as well.
Yeah. I mean, that is a key part. That's the best case scenario for me on the brand side of things. That to have other partners waiting and ready to jump in and let's get this, let's all sing the same song. And that really worked out very well here. I think also I would say that it sounds a little bit soft, but vibe is kind of strategy here, right? So when our teams were sort of in resonance, I think the entire way, kind of like, singing stones in a way, they put us next to each other and they were singing the same song. So I think we spent a lot less energy managing the relationship and more energy on the actual problem for that reason.
Yes, I think so. And I think there was also that, okay, we all kind of aligned when there was something that we needed to align on major wise. We kind of took the minute to kind of pivot, prioritize, and make sure that you had what you need while we did what we needed to do. And I think that's the piece of people, when you're doing projects like this, the dynamic nature, you can have all the project timelines in the world, but that dynamic nature of being able to intuitively adjust as you go along, I think speaks volumes that you were all willing to do that at the same way that we were.
Yeah. I think we were also as in the details as you guys are. That was something that I think we had to, in terms of messaging and marketing, help you guys rise above a little bit. But in terms of orientation, we were both very into that down in the weeds. Let's figure this out and get the right, the details straight.
Yes.
Is there a moment that you can remember that something that we brought back to you during this process that really kind of crystallized something that had been hard for you guys to articulate?
Yeah, I think when you were doing the positioning work and you were presenting to me and Kevin around, okay, here's the direction that we can go in from your identity, and we had to make a decision around how much do you want to embrace this category of AI? Is it is it a supplemental piece or is it really part of who you are? And I think that was a pivotal moment for us because, a lot of the language and all of the info that you were getting was really directed toward this idea of AI being central to our positioning. And you brought it together in such a way that it made it really easy for us to make that decision. And so when we landed on healthcare ready AI, I think that just became such an anchor for not just me, but for Kevin, who's our CEO, as well as the leadership team around, okay, so if this becomes the anchor, how does everything we do support that story? And how do we now create the substance behind what healthcare ready AI means? And I remember you and I having those discussions, right? Like healthcare ready AI, it seems really lofty, but you and I both really agreed it's about what you say beyond that really supports how substantive that you make that feel.
I would love to show something that kind of illustrates the point that we're talking about. So this is where we actually started with your main messaging. And I would say that, we wanted to talk about you guys being this bridge metaphor, that it worked for every audience. You guys were the bridging the gap between vision and reality for your life sciences partners. And for health plans, it's like, stop building bridges between point solutions. And for individuals, it's like, okay, connect what you're tracking to how your life changes, right? So this is kind of where we started, but and it turned out to be more of a messaging point ultimately. It's actually kind of functional. But what I can say is you guys chose the bold route, which I'm never unhappy about. It turned into sort of more of I kind of saw Healthcare Ready AI as a tagline and a headline and also a category that you guys can start to own. How did that land? What was your thoughts when we were going through all of this and I was showing you some other things, and like, what made you decide this is the way to go?
Yeah, I think it actually, in the sea, and I mean, everybody who's listening, I mean, if you've not lived under a rock, everybody understands in healthcare, AI is so much of the noise. And I think, Kendra, you can attest to how many times Kevin said, like, how do we cut through this noise when everybody's sort of talking about AI, but it was chaotic, it was frantic. There wasn't really a way to see through. And I think Healthcare Ready AI allowed us the space to not only sort of define it, but declare how we wanted to define Healthcare Ready AI. So it not only created this, like you said, category, but it's like, okay, you own this category now. You all talked a lot about all of the things you're doing. Now it created our definition that we could then now start to embrace and basket everything together, if you will. So, even I was working with our chief AI officer and we're defining our, we're just clarifying a lot of our AI strategy because it's going to keep moving and moving fast. And he said, this is what Healthcare Ready AI is. And I was like, oh, Kendra would love that, because we're really, we're really, really using it in how we define our product.
Yeah, and I was going to ask, like, how is that working for you guys? Now that we're a few months into this, are you finding it's an easy switch to make, an easy thing to sell? How are you using this in the world?
Yeah, it's a great question. I think, we are using it as the foundation for what we are. And it's allowing us to create very segment specific, because I think that was one of our challenges that we were trying to sort of figure out is we are everything to everyone all at once. And Healthcare Ready AI gave us the foundation to be able then to create very specific segment language for each of these categories. So we can relate how our clients want to leverage AI. We can relate to our regulatory and clinical rigor around AI and explain that we have the frameworks and the governance to support trust and credibility and clinical rigor, because, the rest of the world is talking about AI at a pace without some of those anchors. And so it allowed us the space to define all of the things that we're doing that are very differentiated and unique, to declaring us a pretty differentiated partner in the space of AI.
Yeah, and that was, I mean, honestly, that's what I wanted with the phrase itself, is to give you guys something like put a stake in the ground and say, okay, it's like AI that's ready for all that healthcare demands of the world, of regulation, of doctors, of everybody. And, all the safety and the security and the HIPAA forms and everything, it was the natural nod to Welldoc's rigor and FDA patents and, all the regulatory expertise. And I think it's just a world apart from what's else is out there. So I'm glad that it's something you guys can grow with.
And to your earlier point, it was a purpose towards connecting, right? So it wasn't AI just to do AI, the purpose to connect people to better health, to connect to better outcomes, to connect to our value, right? And so it allowed us that language to talk about, we're not just doing it because it's the buzzword, we're doing it, and we have been doing it to personalize healthcare, to make it work better, to drive more efficiencies, to help drive that next caliber of transforming the care continuum. So it kind of has so many different angles that we can go in. I'm curious for you though, right? Like as we talk about that regulatory rigor and because we have that FDA clearance, we're held to a standard, it's not as bad as what life sciences has to do with rigor, but it was
Sure.
a big part of, being careful about claims. I'm curious how you all navigated just some of the sensitivity around our higher standard that we hold ourselves to from a credibility standpoint.
Yeah, I will say that working in marketing or branding for healthcare is a muscle that you build. Because in some ways, even on a tactical level, there are things that you just have to have you have to get a feel for what you can and cannot say. There is always a legal review. You guys were much lighter on that than I think some of the things. I've worked in healthcare devices and life sciences and things. You are correct. They are redlining every word and making sure everything is absolutely perfect. This was a little bit of a looser kind of thing, but we still had to be very cognizant of let's not claim specific things. Let's not be overly, one way
Lofty.
or the other. Really
Right.
lofty too. Yeah, we have to be, pretty specific as to what something does and what its benefit is. And I think it's just, for us, for one, we have just internally, we have a large amount of healthcare and healthcare tech expertise. So it's kind of that muscle that's being built, but also just a really good draft and copy review process. Honestly, I think that went, despite the fact that we kept having to unlock and lock Google Docs all the time. that was kind of a pain. But but despite that, I think that the review cycles between us and you guys are the subject matter experts. We're going to be able to get you so far, right? And then you need, the client, especially one in a complex industry like healthcare, is going to need to come in and have that second set of eyes and say, yeah, so this is right. Like the vibe is right, but we can't say this. Give us some other options.
Yeah.
So that review cycle back and forth between our team and yours was incredibly valuable. And I think it wasn't a small site. I mean, there were dozens of pages, and a lot to say. So it took a good amount of time, but also a good amount of organization, and
Absolutely.
to get it done. And so yeah, that's
Yeah.
how I would answer that.
Yeah, and I don't know if you know this, but while we were doing all of that, I was lovingly going through all of the copy with my counterparts on the leadership team and others and just getting their thoughts because I wanted this to be owned by all of us. It's not just a marketing project. This had to
Yes.
be something that we all embraced as a company. And so it was really lovely to see them, seeing how the story was coming together from, those first discovery sessions to seeing the words come on paper and getting them really excited about, it's hard to get excited about copy, but just seeing how the story was coming together and having them be participants in that. So I wanted you to know, like I was doing that behind the scenes, and that was why I had to keep unlocking it because it was prompting conversations here around, oh, we should say this, or this is something that's emerging that we're doing now, right? So it was that constant iterative force, but it also gave me the knowledge that we're going to be able to keep this updated and continue to be fluid as our story has to adjust to what the market dynamics are and what, is happening in this space right now.
That is fantastic. Thank you for letting me know that. And just that I loved that what we were creating was in real time, helping you start conversations with leadership.
Mm-hmm.
Because I think that is like what a great use case for really working on something in depth copy wise, and then also tying that to brand. And I think that we had a really clear kind of through line the entire way. Like it was
Mm-hmm.
never like we really didn't veer off course. And I think that that's a testament to everybody. You're like really being ready to be in it. And I'm glad that you now you're like super educated on exactly what we say. So I would love to just take a step back and ask just a little bit about like, okay, Welldoc, why is what you guys are building, why is it so important?
Wow. Well, I mean, talk about passion. I think everyone at Welldoc is here because we truly do believe that we have to do a better job at making it easier for healthcare to work. And we have to do it for the people that are at the center of it, which are consumers. And I think you're seeing, it's actually such a great time to be in healthcare because I do feel like for the first time, health tech is now being acknowledged as the center of care rather than off to the sides. And I also think the consumer is becoming so much more important and what they need. And this concept of patient is such a limited view of individuals in the healthcare journey, right? A patient is somebody that's sitting with a doctor in a moment in time. And now healthcare is so much more complex. People want more things. They want to understand their data. They want to understand their personal experience, and they want to get guidance that makes sense just for them based on their conditions, based on their data, based on their goals, and based on their specific challenges. And we really are at the helm of helping people do that in conjunction with their clinicians and care teams. So I do feel like, again, goes back to that connection. We really are in that moment of taking all of this great opportunity to bring all of these diverse data sets. Just think about all the data that we have between our doctor visits, our sensors, our trackers, our blood pressure cuffs, all of the things that we use to monitor our health. And people are having to go to a multitude of different places to actually gather it together. And now our theme is bring it all together and get insights and get guidance that actually matters in the moment and over time. So you ultimately are building better habits and you're ultimately getting healthier. And for clinicians and for our customers, this is leading to better outcomes and more value, right?
Yeah, absolutely. It was all of those things that you mentioned were the things that make creating a brand not, I wouldn't say it's never easy, but if you have a mushy value proposition just internally, right? If you have a lack of kind of direction that you're pushing a product, or if it's just kind of vague, what it makes you different from any other company out there. And my job is obviously to find those things and pull them into the light. But it was particularly easy because there was so many things that you guys are creating that are pretty unique. The idea that connecting to it's like I don't know how many hundreds of different kind
400
of
plus.
400 plus. I cannot believe that I forgot that because
I know.
I certainly wrote it 700 times when we were done. But yeah, 400 plus wearables and different inputs and things like that. And it truly is, that's where that sort of bridge idea came from. It's like truly helping put together what healthcare tends to keep apart. So that was one of the things that just sort of made finding the right story a little bit easier in your guys' case.
I think the other thing you helped us is really crystallizing our special sauce, which is our partnership model. As
Yes.
opposed to doing these things in a silo on our own, we really do embrace our partners and build it together, which is what we should be doing, which is another vein of connection, right? Create these programs together, create these models of care together, make it be tech forward. That's sort of our special sauce in helping our partners do that. And you helped us really be clear about that messaging of partnership.
This was a project this is a brand that has a number of different audiences. That's one of them. One of them is an individual user audience. So, the site itself is kind of dual-sided, right? And
Right.
we launched it in two phases. We had the enterprise side first. It was the most complex. It was the one that needed the most kind of, brain power and force put behind it. And then once we got all that kind of set, right, we flipped and did an individual side. So, how do you, in your mind, as a marketer, how do you build a brand and an experience that kind of speaks credibly to both without
Yeah.
watering it down for anybody, really?
It's a great question. And, we've spent a lot of time, and you can even see it in the visual representation of the enterprise site versus the consumer facing site. We really, you want to make it, you want to showcase how you're making it easy and simple and seamless for individuals. We know that for health tech, people have so many options and choices. And so we really have embraced for people that are dealing with pretty complex conditions. And, it's not the easiest thing to want to embrace. How do you make and motivate people to want to embrace this journey and make the best of it? So you see a lot more of that empowering language and warmth that comes through. And, as much as we are that tech forward voice, we also want to represent that we are always thinking about the end user and spend a lot of time thinking about the seamless user experience. And that's represented in that individual site, I think.
I was going to flip over to the individual side here and show. I was showing the Welldoc for enterprise first. You can see, all of that really vivid color. I want to talk about design next because that was one
we
of the
have to
things
talk
that was
about
the most
design.
exciting. Yeah, and I wish we should have just brought Robert here to talk about it. But
yeah, as well as my design team.
Exactly, we should have brought everybody into the call and talk about it. It was an incredible collaboration. But so this is the enterprise side, and then you can see as we go over to the individual side, things shift. They feel really light. They feel really, as you said, friendly, and it's an entire flip of the viewpoint and a flip of the brand. Just for edification for anybody that doesn't know what we're looking at here, Welldoc, people are going to probably visit this side of the site after they've gotten, let's say an email or some kind of communication from their healthcare provider or from their plan that their insurance provider.
Right.
So
we're not a direct to consumer, but we're not a direct to consumer, but we partner with our clients to make this program available. And so it allows people who may not be familiar with Welldoc or being offered this program just to have a little bit more information around what they can expect, how they will experience this, and really just motivation to knowing that there's help for pretty complex conditions.
I love the idea that we have a bunch of really great success stories here, and I'm sure that that's something that you guys are continuing to build out. This is
absolutely, yep,
super inspiring, and things that if you're a human getting this app, you can say, yeah, let's see, what it's done for other people. Well, let's talk about design for a minute because I've got it up on the screen here. So I wanted to show first that we started. This is where we landed, right? And it is here. Let me take the toolbars away. There we go. This is. You see, it was direction 3.2. This is we were into 0.2s at that point. Point whatever. This is an incredibly different looking healthcare brand. Healthcare is typically, in my experience, very white, very green, and very blue. And every industry has its own kind of set of colors. We wanted for you, and this is one of the things that I think we pushed you guys on, that pink especially, we wanted for you guys to look just entirely different, for there to be a dark side and a very saturated side, and to sort of mimic the energy of what you're creating. So tell me a little bit about when you guys first saw this, what were you thinking?
Yeah, so this was a big adjustment, not just for the marketing team, but just in general, right? We had to think not only about, this new direction, but how we would pull it through. So I think there was an initial fear of how can we pull through this big change across our company? The other piece of this too is that we also have a product, right? And so we didn't want our brand to be so different from what we were building from a product portfolio standpoint. So there was another perfect timing in all of this, is that we were going through a big user interface revamp as well on our product side at the same time that we were doing this project. So I think we became over time more comfortable with this direction when we started having internal discussions about what could this mean for Welldoc and how do we pull this through together as a company rather than in a silo. I think our teams, to your point about collaboration, bringing this to life and the multiple versions this took really was a collaboration. I know I want to thank my design team for, you probably don't work with a lot of clients that have, the design expertise internally. And so I think it just made the color palette and our choices stronger because we thought about every shade of blue. We made sure that we had some connectivity to our old brand, so we had the time and space to move it forward. We thought about accessibility of these colors because we had to from a product standpoint as well as from a website standpoint. And we thought about how these colors would work in conjunction with our product, with our messaging, right? How we would pull these through. A lot of that work happened as you brought these options to us. And I know it took, within a very short time frame, a lot of us thinking through that lens. And I think that's where that it was a juicy time, I know, for the teams, but we really did come together around how this would all look.
Yeah, I totally agree. And the help of the internal Welldoc design team was pivotal in, especially, it was absolutely a valid concern to be moving from here's where you all were,
Yeah.
it was very yellow and very blue. And then we're proposing, hey, let's just blow this out so it looks maybe a little bit like an 80s roller rink in some cases.
Yes.
Not to throw any shade on it. It's just the colors were so saturated and so they pop so lovely against, a lot of the darker tones. We did a transitional palette, which is what I was showing before, sort of a phase where we started using the swoop and the overlapping kind of features in with the old color palette in mind, and then it kind of turned into this eventually, which is
Yeah.
how's your team been finding using the system at this point?
Yeah, well, I think we developed a lot. My team then took in a lot of the, once we made this decision, I think we both divided and conquered the assets that we really had to develop. So a lot of the visual representation of our product fell on the Welldoc side, right? To really get right. And to your point earlier about who knows the brand more, once we made this decision, I again want to thank the whole entire marketing team because we really did then sort of once we made the decision, we embraced it, right? And then figured out how to move forward. And I think what we're finding as a team is it's allowing us a little bit more breadth to go in a multitude of directions. Like we really wanted to understand the why behind the colors too. And I think we pushed your team to kind of give us some of that. I know you sent, we were asking about the pink a lot and what we sort of started to research and understand that pink is used a lot for tech forward, AI forward companies, not in healthcare. And so it was an opportunity to differentiate. So we really then, our design team really started to develop that brand guideline and how we were going to use it stylistically. When do you use the pink? When do you use a darker palette? How do we bring in the lighter colors when we're talking to consumers? So we really did have to think about it for the website, but also how we pull it through a lot of our different assets.
Yeah, it's never one end point. There's always,
No.
a million different ways this is going to express itself, right? I would love to hear if you have one off the top of your head of a situation in which this new brand, the language, the site, that it really worked in a room, like where, a sales rep used it or things just landed differently for Welldoc than maybe before.
Yeah, well, I'm going to use one that's not even related to this. One, I'm going to just say, so when we launched our website, I shared it with my 18-year-old daughter, and she shared it with all of her friends, and they all gave us feedback. And just to hear that generation talk about what they
I
felt
would
when
love
they
to hear
saw
their
the
feedback.
right? They thought it was really forward looking. They said that it was clear what we did, and as much as they could understand, a lot of them were like, what is this? But, they were able to understand and grasp what we were trying to do. They loved the color palette coming live. They said movement. So it was like this movement forward. So I thought it was really, really interesting. But since we've launched too, a lot of the employees at Welldoc, they're so prideful in the website and sharing the brand with their friends and family and having our friends and family understand what Welldoc does. It's been a great way to convey that. It's been a great way as I introduce new employees to our corporate strategy. The website's actually becoming the greatest tool to help share our story because you can just walk through the website and it's very clear who we are, what we do from an AI standpoint, who we are to different segments. So that has just become part of our DNA. And I think people understand, even when they're interviewing for jobs, they understand Welldoc so much. I hear a lot about our website in those conversations as well. So from that perspective, it's really, really working. I also had a chance after we launched to talk to our team in Bangalore. So our development team sits in India, which is in Bangalore is the center of tech. It's the Silicon Valley of the globe, right? And so seeing them get really excited about this direction when they are in the tech hub, that was really amazing. And they've been utilizing the website to create partnerships and build talent in their space as well. So that's been really lovely as well. Sorry.
That is one of the underrated things about brand building, or one of the things that I think is maybe not something we talk about a lot, which is that it is an external project. It's an external expression, but it's also a internal and a cultural thing. When you get it right, it can affect, the way that you see yourself internally as a company as well. And as you said, your team in Bangalore is, they're excited about it. They want to share it. They want to create partnerships. They want, that kind of thing. And then just understand, like having a sense of ownership of like, yeah, this is what we are, like, and then being able to move forward with that. Does that resonate with you? Does that sound right?
Yeah. Yeah. And I would say I think from the sales angle as well, and those that are external facing, they've been able to leverage the website, sending links to specific pages, right? Like it's allowing to have substantive conversations just from the website, or sending that site before a demo or before a client conversation. There's this foundational knowledge that people come to conversations with just based on that website. So it's working really well.
So this is kind of a meta question, and it's not one that I would ask every client because I would be afraid what I would get back. But what what was the hardest thing about all this to get right? Like, were there, what was the friction? What was the hardest thing to feel really good about in all of this?
Well, I will just say, and again, kudos to the marketing team. This was not the only project we had going at the time, right? We still had large efforts running, huge changes to our product were going on. We had a new PR firm. So there was just the volume of doing this in conjunction with everything else, which, that's the marketing's jam. That's what we do. So it was just, leading that. I think the other piece is just the pace that we wanted to do this in. I think that was, we both have lessons learned from that. But I think that ambition to get to a good place in such a short time actually pushed the team to really be, judicial about the decisions we had to make, to prioritize what we wanted to get done, and also give us the breath. And I think, to Kevin, our CEO's credit, he gave us extra space to get things done when he realized that the project was getting more complex, because we wanted to get it right. More than on time, we wanted to get this right. And we knew this was our one shot to do that. And so I think it was that energy that we had to get this right, but also, over time. I mean, it was a stressful project, but we did give ourselves a little bit more time to get this right towards the end.
Yeah, and we definitely felt that from our end as well. It was, it was I mean, not the shortest project ever, but with regard to the amount that we needed to accomplish and the amount that we were switching a brand from one thing to another, and then the amount
and the
of
complexity of the site. Yeah.
Exactly.
I mean, I forget what Mary Beth, one of my leads on the marketing team said, but I think our site is now 10x the size of what it was before.
Yes. And we accomplished that while you all were running other marketing things, while we're doing a brand at the same time. Like it was a lot of moving parts and pieces. And I will give a shout out to our project manager, Abby,
yes,
for being just the best at organizing and wrangling two teams of cats at the same time.
And Danielle Caslow on our side was really point with Abby, right? Like
they were
both
linked at the hip for like 6 months.
And you do. We never thank our PMs enough, but they do organize the work. And without that, I don't think you and I would have been able to do what we did to make decisions. And again, the design team on our end, we were building our own Figma files as you guys were. I mean, there was a lot of in parallel and bringing the two teams together at the right points. But yeah, it was definitely a collaborative on steroids, I would say.
Hey, we pulled it off, and it looks
did.
nice.
We did.
I want to back up and talk about just sort of, the moment of AI in healthcare right now. So why is this the right moment for Welldoc's healthcare-ready AI to exist?
Yeah, I mean, I think we had to take a stance on who we were in AI because we've always been in that space before the world was ready. And as everybody knows, AI and the enormity of what the potential is to impact healthcare is just it's here, right? Rock Health just did a consumer survey, and they were said 3 out of 10 people are using things like ChatGPT to get health information, and that's up from double from last year. So just the momentum of where we are as a society and where consumers are in embracing these tools because they need other things to help them through their health. I think there's just an understanding that AI is going to create more efficiencies. It's going to create more personalization. It's going to create the opportunity for people to stay healthy, be healthier, and to help connect them to clinicians in a different way. So I feel like we had to do it at this point. Because if we didn't create this foundation, we wouldn't be able to continue to build the momentum in line with the rest of the world in healthcare right now.
Amazing. Is there anything else you want to ask me? I've got a few more questions for you.
Yeah, I would
got about 10
love
minutes.
to hear. Yeah, I mean, one of the things that I think was interesting is, with agencies, right? You were bringing in all of your subject matter experts in and out of this project. So I'm curious, how are you, you had your dedicated team, but you had experts that were coming in. How are you all keeping track and keeping an eye on all of this coming together?
Really great project management again. We also have a structure where we have sort of two dual leads on our projects. There's a project manager, and that person's job is to make sure that the project is running on time, that it's running on budget, that we're communicating really clearly with the client at any given point to run all the, the weekly meetings that are account specific. There were like 15, 30 minutes that we're not necessarily presenting work, but we're talking about what we're doing now, what we just did, and what we're doing next. And then running those just like clockwork. That's one. We also have another lead on every project, especially every brand to build project like this, which is called the engagement lead. It's basically like a creative director in some ways, but their job is to make sure that the work is good. And it's also to make sure that the people that are, as you said, are coming in and out of the project are as I said before, singing the same song, that they know what their part to play is, that they've gotten the information that they need to come into the project, to know where they start, to do what they need to do. Like I think at one point we had Myra working on UX flows for you, and she's a UX researcher here that we have, and she did a great job looking at the audience groups and saying, okay, we've got all these audiences, how should we speak to them? And then she comes, I was probably first to the table because I'm strategy, so I'm setting the biggest tone, and then we're kind of whittling down from there. We have UX was worked on this quite extensively. We had design. Robert was our visual identity designer, and then we handed that off to Kate to exemplify that on the website. So there was a lot of people, as you said, come in and out, but it's just about, we kick off a project as a team. We typically know the full extent of the team when we start a project, so we know who's gonna be there. And then everybody knows their role, and they know where they slot into the schedule, and then they pop in, they pop out, and then we all also circle back and retro every project that we do after it's finished. So we take time to say, okay, this one went really well, or this one was a little bit rocky. What can we learn from this? And it's always kind of, we always end up filtering things into like, yeah, what was the client relationship kind of like? What was the relationship between each other in each of the different kind of, tasks and roles? And then, how did the work turn out at the end? And we always kind of triage that or retro that afterward. So every time we do one of these, I like to think we get a little bit better at it and it gets a little more seamless and there's less bumps. But as Mason, our founder, always says, no plan survives first contact. So we're also built to be flexible. So
Yeah. Well, we appreciate your flexibility. I'm actually curious. That was going to be my last question is, were there any big takeaways from you or learnings from you as you went down this journey with Welldoc? And
yeah, I think that we learned a lot about our where we have some holes and discrepancies in our content production process because what we're doing with large sites. We've, as a result, been changing that a little bit, trying to make it a little less onerous for everybody on both sides of things. When you have a lot of moving parts and a lot of, say, comps that have copy on them or wireframes that have sort of real copy on them. And it's like versioning gets out of control. It's hard to know. It's also hard for you guys as a client always to see what something really is like until it comes together on that one screen. And so figuring out like, where do we say like the real stuff is? Like, how do we, because editing in Figma, like, and multiple rounds, oh my goodness, is that a pain? So it's a lot easier to track changes and things in Google Docs. So we have to kind of figure out like where the crossover is. I think design wise, we were particularly happy with the way that we grabbed a concept to begin with and just pushed for it, and that it really tied the entire, work start to finish together. It was very aligned with the brand that we had talked about with you and very kind of, as you said, forward looking and modern and very closer to AI and tech than healthcare and tech. Right. What else did we learn? Like, this is the point I'm like, I want everybody that we worked on this project to Slack me and say what they learned. We had,
we should
I don't
do
remember.
that session too.
Yes, we should
do that.
I don't remember there being particularly like a lot of migration issues in this one. Some projects are difficult to extract the information from the old system into Webflow. And that's another thing. I mean, we haven't talked about Webflow at all. You all are in, a great position to be able to control your site now. And I don't remember honestly what you were on before. Was it WordPress? I think almost everybody's on WordPress.
Yes, it was on WordPress. Okay. Yeah.
How are you finding working in Webflow as we've launched now? We're a few months in. Are you able to use the system the way that we had intended?
Yeah, I think we are. I think you always have to have that technical knowledge. So I think there is still a learning curve. I mean, nothing is ever going to be this magic pill, right? But, I remember Danielle on our team and myself right before launch, we were going through and it was so easy to just make final tweaks to language, and just small things that used to be incredibly difficult for us. So, that ease of doing some of those simple things, I think has gotten easy. I know we built some custom capabilities in our website, which make it really, really special. So I think that's taking some time just to come up to speed. But I do feel like, you all did a great job in, recording sessions and doing learning sessions with our team to at least have that repository of info so that we are able to carry it forward. I think we're still kind of navigating what's the right level of support we need from Webflow, from you all. We are actually working with our India team to make sure that we've got some tech support from them. But, the hope is that it's an easier platform to come up to speed on and that we're able to support it. And, we're already creating new landing pages, new pages on our website, right? We're already changing content. So that is becoming a much more fluid process than we've ever had before.
Yeah, that is so good to hear we walk away from a project. And we we don't always, and we never totally walk away, but we often have a period of time in which we're still sort of working together sort of granularly. It's really good to hear that you all are able to stand up your own pages and to do all that work that is just like baseline to being able to manage a site of this size,
Yeah.
and in a changing marketplace, you all are changing your products, you're changing the way the world thinks about them.
Exactly.
So yeah, there's a
Yeah.
lot to do.
And I think we've also had a lot of great discussions about SEO and AEO. So now it allows us to really focus on some of those other things that are becoming really, really paramount to your brand, that are founded in your website, but, need to be aligned as well. So it's a really good new foundation for a lot of the work that we have to do now.
Well, as we wrap up here, we're coming to the top of the hour, and I want to thank you again for taking this
Of
time to talk
course.
with me.
Thank you. It's been a fun conversation.
I know, right? What a great thing to do on a Friday, to remember
Yes.
remember a good collaboration and talk in depth about a project,
Yep.
and then float into the weekend. So last question for you, I guess, is, if what would you want a leader or a CMO at another complex, complicated company to take away from an experience like this, both, the work and the process?
Yeah. So I would say number one, you have to be open, right? You have to be open to understanding options and having someone look at your brand from the outside in and what that offers to you in terms of potentially new ways of bringing your brand together. So I would say you have to be ready to kind of embrace looking at a different angle. I would say number two, your team has to be ready for the work, right? This has to be collaborative. I don't think it ever works out well when you have an agency that's going to do this fully without that ownership sitting, both from a content and a brand, right? It feels really special to all of us because we took ownership of it, from beginning to end. And you felt that, right? Every word, every design really had our lens on it and our heart in it, if you will. And so I think that collaboration, knowing what it takes to partner, and we sell this to our clients too, right? If you want to create quality, that ownership from both sides really has to come through. And I think that was a big part of this. So I would encourage anyone that's going to embrace this journey to embrace it fully, but know that it is going to take dedication and commitment and flexibility.
All right. Well, that is fantastic and a great way to end. Thank you so much for your time, Marina. And maybe we'll do another one of these where we bring everybody on
Yeah.
and be like, hey, what
Yeah.
did we learn?
Yeah.
So
And thank you to your entire team. I know on behalf of Welldoc and the entire team, we really, really appreciate everything that your team has done and all that we learned along the way. And we know this isn't goodbye, but we loved working with you all.
same. Absolutely same. All right. Well, thanks for everybody that joined us. And thanks again to Marina. And hope everybody has a wonderful weekend.
Bye.